So, as we focus on COVID and we practice self isolation, it's left many of us to fend for ourselves when it comes to self diagnosis and treatment. Or in some cases, some of us are toughing it out and waiting it out. But as we know, that can sometimes backfire, and especially when you're dealing with certain conditions like back problems. So today we've got Dr. Christopher Good from the Virginia Spine Institute and his patient, Christine McGuire. And Christine, I know you know firsthand what this is like because you've been through the ringer with your back issues. And Dr. Christopher Good, you know what this is like too because you've been treating patients who have been dealing with these issues. They've been putting things off because of COVID-19, because of the pandemic. So thank you both for joining me today and for talking about this issue. Christine, I want to talk with you first about the back problems that you've been suffering from, because I know you have had some real trouble with that started with a simple ankle sprain that turned into sciatica. Take me through this debilitating back pain. Explain to me, you talked about screaming and crying like it was crying on a battlefield every day. What happened with you?
So, like you said, I sprained my ankle and then I started to get sciatica pain and it just kind of got worse, progressed very quickly. And it was excruciating almost immediately. So that started in the beginning of October. And, I went to the doctor and I did many different things to try to deal with it. Nothing helped. Nothing.
You went to several different physical therapists, a chiropractor, you saw a few different doctors. What were they telling you kind of in a nutshell?
Well, when it first started, of course, nobody was jumping into surgery right away. So they just had me do physical therapy. We tried injections and I went to an acupuncture. So chiropractor, I tried everything. And so we were kind of trying to do it that route, but nothing, it was not getting better at all. So I sought out another opinion and I knew I had a cyst in the area. So I was doing a lot of research because I'm a nurse. And so I like to do all this research. So I've been researching for this whole period of time that this was going on, that I was, also doing all these other things to try to, get some relief from this. But it was progressing so that I couldn't really stand for more than a couple minutes.
And I know you had some doctors who were telling you you couldn't do surgery right now because of COVID. But you did a deeper dive and then you found Dr. Good. And what did he tell you? It was time to get you in, right? Immediately.
Yes. So I went for my final, it was my fourth injection. And the only reason they did it is really, because they only like to do 3, but they did another one because they thought maybe it'll give you some relief. So I had that, and this was April 1st, I believe. And so I thought, you know what, I'm just going to call their office and see, maybe I can get started when this COVID thing is, because something needs to be done. I just can't.
You couldn't put it off any longer.
I just couldn't, and I was like, somebody has got to help me.
So Dr. Good, I know she came to you when her pain was a 10 out of 10, and this was serious, and it was during the COVID quarantine. You knew you needed to move quickly. What was your reaction when you saw Christine's case?
Well, sadly, this has actually been kind of a common scenario. Coming out of March into April, no one really knew what to do, and everybody was shutting down. Patients were left without being able to get care. And so we worked very hard to be very cautious and move to telemedicine. But we know there are people who have spinal problems, nerve damage, spinal cord issues, where time is of the essence. And so we managed with a very small staff and very cautious measures to stay open. And what we actually saw was that patients from all over were coming out of the woodwork because they couldn't find care, and they were scheduled for surgery here, and literally that system just turned off and just disappeared. And so during those first couple of weeks, which is right when Christine was coming in, this was actually happening all the time. And so here, this was sadly altogether common. Maybe I'd see only 5 or 6 patients that day, but we'd end up admitting 2 or 3 people to the hospital. And she was, dragging herself into the office in tears, leg falling out, crawling around her house. I mean, these are people who are in misery, right? And so when I saw her, the nice thing about her situation is we knew that there was a relatively small, safe surgery that we could offer, even with everything going on with COVID, where we could get in, we could do something small, get her out of trouble, stop the nerve damage. And for her, we were even able to avoid having to come into the hospital. Obviously, at that time, we didn't even know what the future was going to hold with COVID. And so there was a lot of fear and misinformation. And so we knew something had to be done. I mean, she was at the point of misery where, you almost stop thinking straight, and, people's lives are in danger with some of these kind of problems.
And when you consider the differing advice that Christine was just talking about that she got from all those different medical professionals, and she was refused, the service that she needed to get into, that you gave her to get into the hospital immediately. What's your take on all of that? That's confusing for a patient. What's your advice for other patients?
Well, I know a lot of the people who are taking care of her, and it was a challenging time, and we all had to sit down, and some systems just said no. We really felt what we do, we feel like is really important, especially in situations like this. And so I always think that patients need to advocate for themselves, and especially when it comes to spine, lots of times you'll get a couple different opinions that are sometimes it's hard for patients to figure out why one person's recommending one treatment versus another. And the great thing is, obviously, Christine's a nurse. She's been there and done that. She was comparing, she was researching, and, she didn't stop. She got kind of dropped and abandoned at the last minute by someone who was planning surgery and then refused. And she kept looking. And obviously, we wanted to be there to take care of all these people in need. So if you are a patient, especially now as we see the direction we're going with COVID, you're having troubles. I do think we're at the point where for a lot of people, the risk of delaying their treatment is starting to become more than the risk of COVID. And we're trying to balance that for people. But if people, for Christine, if you're absolutely miserable, your leg doesn't work, you're falling, that is the time to get treatment. And we've been lucky that we've been able to take care of people throughout all this. And we kind of said, we're going to be there for people. And obviously we formed a great relationship and so many people over this last month and a half.
Christine, how are you doing today?
Doing great. It's like I have my life back. Honest to God, my children, I have to give props to my children who supported me while I was crying and screaming and carrying on every single day. And, I think I'm a pretty tough cookie. So to have me, and I couldn't do anything, I couldn't cook dinner. I couldn't go to the store. Because I couldn't stand up for very long. And it was getting progressively worse. And I was really worried about permanent nerve damage. I really felt like I was going to be paralyzed or something was going to happen. So I just am so grateful that I kept on advocating for myself and said, somebody I know can help me.
Yeah, well, it's a really interesting conversation about the essential versus elective, and exactly what you're talking about, Dr. Good, about really being your own best advocate, knowing what is going on with your body, and doing the research. Thank you both, Christine McGuire, Dr. Christopher Good from Virginia Spine Institute. Great conversation.
Thank you.